information, as I said, put out by the ABA, 2009. This was meant to, I suppose, impress us vets, you know, all the work that we have to look forward to. And as I went through it, I was kind of mortified by these statistics. This was meant to encourage us all to do more veterinary dentistry. You know, 60% of pets over 3 have dental disease. It's kind of like, okay, if you're into dentistry, you can start getting those cats in at 3 and cleaning their teeth. But what that tells me is, my God, what are we doing wrong? And why are all these animals at this young age got terrible dental disease? You know, why is it we keep opening mouths like that? And that is just putrid, and that is really common to see when you're in practice. Obviously that's more than a 3-year-old dog. 80% of pets over the age of 8 have degenerative joint disease. Great seller for Cartrophin, Epizan, and Carprofen, and Rimonil, and all the other things. But again, why? Why is that? Not so good. 60% is in Australia. 60% of pets over the age of 4 are either overweight or obese. Looking at your animal, I've got a fat Labrador at home. Well, a little bit fat. But again, this, you know, this can be love, this can be treats, it can be all those things. But as a statistic, it means that we need to be looking as vets at that. And I mean, in the old days, we used to look at obesity or overweightness as just, oh, look, it adds a bit of weight to their body, they're probably going to get degenerative joint disease. But the more we learn about fat as an organ in the body, the more we realise that it actually plays a massive role. It produces hormones and all sorts of things. So, unfortunately, and I can only say since I've lost a bit of weight myself, that keeping on the leaner side is good for animals as well as us. So you don't want these dogs rolling into your clinic. That's photoshopped.
I hope so.
I'm pretty sure there's a big cat in here that's not photoshopped. This came out of a study based on cats that were kept at one of the university facilities. So they're basically, you know, health check, vaccinated, wormed, everything was perfect, fed on the top 10 dry food, and the average age of death was 12. This is in the perfect university, you know, clinical environment. Number 1 renal failure, number 2 cancer. 12. You know, I mean, I'd like to think the cats live a bit longer than 12. I can tell you my 21-year-old cat is still thriving along with his slightly failing kidneys. One that I focus on probably the most, 1 in 3 dogs will have some form of allergic skin disease. Now, I mean, that's a big number, that's 33%. I mean, I've built an entire practice on treating allergic skin disease in dogs, basically. I mean, it's an all things practice, but that's what I basically started out. I won't use the word specialising in because I'm not a specialist, but it's certainly my strong area of interest because I find it both the most challenging thing you'll ever do in practice and probably the most rewarding when you actually cure, and I do use the word cure. The dermatologist will tell you you can't cure allergies. I beg to disagree, and I'm sure you probably disagree too. You know, allergies are a malfunctioning immune system and can be cured. So, yes, this part's just my blurb, so don't worry about it. I haven't told you all about raw food, so don't worry, but basically one of the big answers for me is about trying not to be brainwashed by the idea that you know, dogs are designed to eat dry food. It has a role, but it's not the best way to keep your pet in good health. And I've proved certainly over 25 years in practice that when you feed animals what we call a biologically appropriate raw food diet, they live long, healthy lives, they're not regular customers, you reduce your vet bills, you reduce chronic disease, and I think one of the lectures I might pop on actually just sort of goes through the conditions that we can actually create by feeding improper nutrition. So that's the end of that one. So I'm going to back up and say, has anyone got anything that they would particularly like to
I like the raw food cat one.
Yep, all right. Let's
That's
go
just
with
me.
that. Yeah.
So that would be great.
Yeah, because you've got a new diet that's come out, or is that?
Yes, yeah, we do have a new grain-gluten-free version of our diet. I've got to admit, I mean, true gluten intolerance is not a common thing. I probably use it mainly with IBD cases nowadays. But what is more important about our new diet is just the low carb. That's what I really should have called it. But popular thinking is grain is bad, grain-free is good. There's an element to that. The truth is, if you look at most grain-free diets, all they've done is substitute the grain component with another carbohydrate. They actually haven't come out with terrifically high meat content diets. So you need to be careful that you read.
And you have to also define the meat, what the meat content is.
Yeah, there's only a very short little one, but it's just a reminder about feeding cats. Some of us forget important cats are. I should be moving over here, shouldn't I? Alright, so pussycats. Let's remind ourselves, they're natural hunters. You know, they are absolutely awesome at getting out there and killing Australian wildlife, small creatures and all sorts of things. As compared to a dog, they're an obligate carnivore. So being an obligate carnivore basically means that there are certain ingredients that they must have from meat, basically. Number one is taurine, second one is arachidonic acid. So they're two ingredients that basically come in animal meat and animal fats. That's why they're classed as an obligate carnivore. Yeah. Just make a simple bold statement. Cats thrive on a fresh meat diet. Now, that's just not me saying it. Any guys, I was going to say old enough to remember Vic Menrath? One, probably. Vic Menrath was, I don't know if I've got his statement here anywhere. Obviously you can see in the wild, that's exactly how it comes. We need to remind ourselves too that, you know, these foods that we feed commonly are a human intervention. You know, animals don't cook their food. They haven't developed the power of lighting a fire to cook their food. So in the wild, obviously, everything they eat is raw. And usually as a good rule of thumb, if we try to, you know, stick with Mother Nature and her principles, we tend to find that everything fares better. Okay. This is a comment Vic Menrath made, it wasn't that long ago actually, he came out with a statement. He basically came out and said, after 40 years in practice and over 40,000 cats under my care, I can say cats that live on a raw food diet live longest. He said, can I verify that? No. He said, that's just purely his experience. So, you know, this was the #1 Sydney University cat professor who specialised in cats. He pioneered the renal transplant system and all that sort of thing. And he made a simple statement, and I thought, you know, good on him for actually stepping up and saying, you know, no, it's not hills, it's not raw cannon, it's not whatever. You know, it's raw meat that cats thrive on. There he was, accepting one of his awards. So, why is it so important for cats to eat raw meat, other than the fact that they're an obligate carnivore? Really important thing to remember, cats didn't evolve in Australia, but they do well in Australia for a good reason. They evolved in Egypt, which is a very, very dry continent. So basically they have created a renal system that's extremely efficient at using water. That's why you don't see cats drink very much in the wild. It's basically why they survive in the internal arid environment of Australia so well. And the reality is, why do they do that? Because 80% of their liquid water requirement comes from their food. So they basically drink the body fluids of their prey animal. That's why they can survive so extremely well, as I said, in the middle of Australia where there's very little water around. So, and that's why they have concentrated urine. I mean, if you go into a hospital, you always know when there's a cat in the hospital. I mean, it's concentrated, you can do a USG on it. You know, they basically have an extremely good renal system. It's also why the renal system breaks down, because it's under a constant load. I think someone basically told me that cats are always in a state of semi-dehydration. They're literally, you know, borderline dehydrated. And of course, what happens if you go then and feed them a food where you take all the moisture out? You dry out a dry body. So you then overwork their kidneys. They've got to learn to drink. Cats that do eat a lot of dry food, certainly you'll see that they do drink a lot more water than your average cat. And that's because they're having to replace it. If they don't do that, then the kidneys pack up, they die at 12, as a general rule, not everyone. But that's why we saw that in that study. And a reminder, you know, so many people come to me and say, yep, I feed my cat raw. It's like, do you feed bones to your cat? I don't know why. People say, feed your dog a bone. Well, you should feed your cat a bone. I mean, basically, you know, meat and bone comes together. And cats can chew really well. Like, people also tell me, they say, oh, my cat can't chew anything. And if you go out and actually look at a cat that's actually had a good feed on a rabbit, what's the first bit missing? The head. How many times you've gone out, well, maybe not, you don't live in the country, find a headless rabbit, basically. That's the cat. The cat breaks into the skull, eats the brains. The skull is a big hard bone, you know, but they crunch through that without any trouble at all. So when people say they can't chew, first thing is look in the mouth, make sure they don't have dental disease, because that's probably the reason they can't chew. But if they can, they will. It's just a case of creating good habits.